both on the air and on SuperTalk TV. You can go to supertalk.fm/watch to see for yourself. Dr. Katherine Pannel, psychiatrist and a board member of the Mississippi State Medical Association. Dr. Pannel, thanks for joining us. We appreciate you taking the time for us today.
Thank you for having me.
Well, and I have been wanting to talk to someone in the, for lack of a better term, the thinking fields for a while here, because this has an enormous impact on everybody's psyche, the situation right now, and I think we're starting to see it exhibit itself in some rather loud ways.
Yeah, so I think we're finally, we've reached that peak. We're finally on the other side of this pandemic. And while the coronavirus is, lessening, I think we're starting to see really an increase in mental health needs. I know in my clinics alone, we're seeing an uptick of new patient appointments, and some of the patients that I already have that have been struggling, they're making appointments sooner because they're struggling more.
And that's kind of the way a crisis works. This has been a protracted crisis, but in the middle of the car wreck is not when you get the shakes, it's after. And that I think is what we're seeing. We're reaching that point almost of a release valve mentally, to where the crushing concern over it and the concentration on the safety and the fear has subsided somewhat. So now there's some mental room to start really having some serious problems with it. Overall, just in general broad terms, are we seeing a lot of people with anxiety? Is it more of an anger issue? What are we seeing?
No, we're seeing a lot of anxiety and depression, and we've even been seeing it like in the midst, in the right in the middle of the pandemic. We were seeing a lot of depression and anxiety. A lot of the social isolation was causing depression, but the changes that was causing anxiety. Now we're really seeing the ramifications of it. We have people that are without jobs. They're worried about their money. They're worried about their families, how they're going to support them. We're seeing the economic ramifications more than we were before. It's just a fear of what we're going to do now in the future.
Well, and I, correct me if I'm wrong, I would expect that it's compounded by the fact that a lot of people feel like, and we hear this every day, we should get back to normal, but we're not back to normal. So that's just adding another layer of stress on top of it, I would think.
Yeah, for sure. I mean, I think even when we get back to normal, it is going to be somewhat of a new normal, unfortunately. I don't know that for a while we're going to get back to that normal that we were used to before this pandemic. And change for anybody can be anxiety provoking, and it can lead to depression.
And I made the comment, I think it was yesterday, with a guest, and I said, people can take a certain amount of change and then they need a break. They need some time to assimilate and get used to it and work through the way they feel and what they think about it. And we haven't had that break through all this. It's been nonstop for months now. Do you think we're finally going to reach that point where people get that break and they can start dealing with some of these things and maybe ease up some of their anxiety?
I unfortunately don't think. I think that we're still going to have ongoing change. The recommendations are going to change. We will get to a place of normalcy, but it's going to be slow. And like I said, recommendations are going to change on what we can do. And that's ever evolving as we go to see how, the virus responds to what we're doing and putting into place now. So essentially, I mean, it is ever evolving. So that change is continuing. It's just going to worsen anxiety. So we really have to tackle this now so that when we are finally over it, we're not seeing a huge mental health pandemic because we didn't address it now.
Well, and that's something that, to me is a problem, because we had some already identified problems with the mental health infrastructure in the state of Mississippi pre-pandemic, before we had to deal with all this. Is there any kind of fear at the highest levels that this is just going to magnify those problems and make it even harder to fix?
So unfortunately, yes, I think that it is going to make things worse. We have a federal lawsuit, as everyone knows. Judge Reeves has come in and they've made the ruling that our outpatient services are not adequate. We are flooding inpatient hospitals. So if we already had a crisis before this pandemic that has not been solved, has not been worked through, it's only going to worsen exponentially. And that's why we've got to put people into place and get going now to make sure that things are in place so that when people start seeking care, we have the appropriate quality services there to help them.
Well, and that leads into my next question. You said you're seeing an uptick, and across the state, we are seeing an increase in the number of people reaching out for mental health services. We haven't peaked on that yet, have we?
Oh, no, I think we're far from the peak of the mental health issues.
And that is a problem. And that goes back to what you just said, though. The time to get all this sorted out is now, not in
Right.
3 months, 6 months when we do start approaching that peak, because this is going to be an ongoing thing. And there's a lot of talk that we may see a second wave of this fall. Pandemics traditionally come in waves. And that would be the time that everyone suspects. We've heard everybody from Dr. Fauci down refer to this, that we could have a second wave in the fall. What do you think the effects are going to be on people if we go back to somewhat of a sense of normalcy for a couple of months, or closer to it anyway, and then have to go right back into the lockdown? Is it going to be that much worse on people if we have to do
Well,
this again?
so, and it's two-pronged. Like, if we don't follow the recommendations now that are in place as we are easing into this, we can spur a second surge. Or there's also this thought that in the fall, this virus may return and we may get a second surge. So there's already anxiety from people fearing that we are about to hit a second surge head on, and we're going to have, for lack of a better word, PTSD from the first surge. So that's why I think it's important to stress that we get things in place, we get it corrected now, so that if we do have a surge, which I'm hopeful we won't, that people can seek good quality treatment.
Well, and that's been the catch for a while here in Mississippi. That's part of the result, part of the reason why we had the federal lawsuit to begin with, is that. Well, and I hate to put it in this blunt of terms, but you can tell me if I'm right or wrong. The quality of mental health care in Mississippi is severely lacking.
Yep. I appreciate your bluntness. You were able to be blunt, and I didn't have to. Yes, no, there is obviously an issue. We have a federal lawsuit. We can't keep ignoring it. But there are things that are slowly being put into place, and I hope that the legislature will appropriate the needed funds. They'll put the leadership in place to get things tackled, so that when we start seeing this mental health pandemic, that we're able to provide the things. I know Senator Hobbs has a great bill right now. I think it's Senate Bill 2610, that puts someone in the mental health field in charge with the special master from this lawsuit, going out and looking at these community health centers to make sure that they are following what the federal government is guiding us with, and making sure that things are in place, the funds are in place to actually provide the quality health care that's been limited for so long.
Do you think it is strictly a funding issue, or do you think it's also the quality of the care that's being provided?
I think it's definitely multifactorial. I think we have been giving the funds. I don't know that they have been necessarily put into place where they've needed to be, but I think that's where it's so important that people that are on the front lines of the mental health care are involved in helping make these decisions to see where this funding goes.
Well, and that just makes a lot of sense. The people that are in the middle of this, they're going to have a very good perspective about what needs to be done and how it needs to be done. The trick is to get the system set up to where A, they're listened to, and B, when they're listened to, the funding is available to make the changes that need to be made in this situation. But no matter what, this isn't going to be a quick process, Doc. I mean, this is not a 1 month fix.
No, and it's not. This is going to be a long process, unfortunately. But there are things right now that thankfully Mississippi has put into place. Governor Reeves has helped with the insurance commissioner. For right now, there are psychiatric services that are in place to help those that are needing emergent treatment now. Before, we were not able to use telepsychiatry. We couldn't do anything but in-office visits. But now we're able to do that over the phone and via video. So there is more access to care.
And you know what? If you can hang on through the break, I want to ask you some questions about that because that's a great advancement. And it's one of those cases, as far as I'm concerned, that we should have been doing that a long time ago, but we kept getting in our own way. And we'll talk more about that when we return here on SuperTalk Mississippi, the JT Show. Dr. Katherine Pannel joining us here today, and we will return both on the air and at supertalk.fm/reviews here, joining us on the air and also on SuperTalk TV. Go to supertalk.fm/watch, and you can see for yourself Dr. Katherine Pannel, psychiatrist and a board member of the Mississippi State Medical Association. Before the break, Dr. Pannel, we were talking about the fact that in the loosening of the regulations, we now have the ability to utilize telepsychiatry options in the state, which is a huge change from the way it's always been, right?
Yeah, it's a huge change. It makes mental health care much more accessible to anybody in the state.
Now, let me ask you this, because I know it's this way for other medical fields. I'm just wondering if it applies to this as well. Are Mississippians also able to utilize telepsychiatry with providers that might not necessarily be in the state, or is this limited to just inside the state of Mississippi?
No, you're correct. Thankfully, because of the weakened restrictions, I can treat somebody out of state, and you can also seek care out of state. But we do have things in place that Mississippians can see Mississippians for the care.
So that's a choice that you can make. It's not just like a random draw. Okay,
Right.
that's good to know. Now the thing is that that helps with the problem to a certain extent because you broaden the field of providers that you can receive care from and you can seek help from. That helps alleviate some of the strain, but it's not the full fix of the problem, even though telepsychiatry, I would assume, just pretty much as effective as doing it in person, face-to-face, I would think.
I'm from Mississippi, so I'm a little more touchy-feely, so I do prefer to have them in clinic. I still love giving the hugs and the handshakes, but no, for now, it is a great way to get good mental health care. And people are wondering, like, how do we get in touch? I mean, you can do a Google search. There's lots of, you can ask for primary care, but the easiest way is just to go ahead and contact NAMI. It is 1-800-950-NAMI. You can tell them your insurance status, where you're located, and they can put you in contact with places in Mississippi to get good mental health care. So that is an immediate fix that we can do right now.
Well, and another question that comes to mind about this, because we have the situation right now, we've been talking about unemployment and some of the low amounts people are getting trying to make it on. There are some folks out there that may need help right now, but they don't have the money or the insurance to go cash in and do it the traditional way. Do they have any options?
They do, and that's why contacting that hotline is so important, because they can give you every option. There are community mental health services out there that are currently doing telepsychiatry. So if you do not have insurance, if you're not able to pay cash up front, they can put you in connection with someone that is still able to see you or talk with you to give you good quality mental health care.
Slightly off the subject here, but I've got your time, so now I'm just going to abuse it, Doc. Sorry about that.
Go for it. Go for it.
Have you professionally noticed an uptick in the number of people that are suddenly experts on everything on planet Earth? And is that healthy?
Okay. So yes, everybody has become a healthcare expert in COVID, and no, it's not healthy, and that is precisely why I say, especially with the news and social media, wake up, get your news, get your social media fix, but then get outside and do other things to distract from this. Just the constant barrage of information is not good for anybody. It's just going to make you more anxious.
It makes you more anxious, and then you buy into a belief of one side of an argument, whatever it may be, and all that leads us to more angst and more anxiety, and it builds, and it's just like throwing the snowball off the top of the mountain. Sooner or later, it's going to crush the village at the bottom.
Right.
And I think a lot of folks don't realize it.
They don't, and just listen to the experts, Dr. Dobbs, Dr. Byers. These are physicians. They have your best interest at heart. Get the information from them. They're not going to be. This is not a conspiracy theory. The virus is there. It's real. It's dangerous. listen to them, get the information from them, follow the information so that we can keep this curve flat and get past this pandemic.
I don't know, Doc. That sounds like something that somebody involved in a conspiracy would say. That's the response you get. There's no winning sometimes. You realize that.
Right. Yeah,
but,
and there's a certain amount that we can only give you as much information as we can. We can only tell you the facts and what you need to do to prevent yourself from getting the COVID. And then, you're an adult. You are the ones that are responsible for processing this information and making your decisions.
And that's the thing that I think we have to remember. Everyone seems to be in a rush to claim their status as an expert, but I think a lot of times in that rush, we completely bypass taking responsibility for our own life, because the safe option is to go argue with somebody else about something that ultimately doesn't impact your daily life as much as some of the other things that you just blow right past because now you have a cause. And that's, to me, one of the most unhealthy things somebody can do.
No doubt. No doubt. We just have to have faith in those that are the experts and put our faith in them and follow what they say. And if you choose to stray, then consequences, are on you at that point, unfortunately.
I like the hand motions. That's perfect.
I'm from the South. I use my hands.
You talk with your hands very well, Doc. You're doing a great job.
I need to be in studio with you. This is all new to me.
Well, and see, that's the thing. It's been an adjustment for us because we're used to having everybody come in here and we sit down.
Yes.
Yeah, and have the conversation and talk, and even during the break, you can talk about things that have nothing to do with what you're talking about on the air, but it's that personal connection and getting to know somebody. And now here we are, doing things this way, but you do what you have to do, and that's what it comes back to. But you talk with your hands all you want. You can't even hit me from there, so we're fine. The thing I think that everybody needs to remember, and I've been trying to do this, I try to look ahead and give what I foresee as possible bad news coming up, but I do it from the perspective of, look, if you accept that this is a possibility that it's going to happen, then it's not such a huge shock if it does, and you can deal with it a little better. We have a tendency to try to hand wave things away, which again is not the way to deal with things. But the problem is, as you said back at the beginning, the changes are just starting. We have plenty more changes to go in terms of how we deal with one another societally. And I think this is going to lead to some long-term behavioral changes, both in terms of the group of mass psychology and individuals as well as the way they deal with things. Do you think that's right?
Oh, yeah. I think this will forever change mental health care. And what I tell my family, and I'm a runner, so they get these terms. I tell them, like, y'all, guys, this is not going to fix this stuff overnight. This is not a sprint. It's a marathon. I mean, this is going to take a while to get over. I don't know that we're going to get back to what we considered norm before, but we will get back to a normal. And we just have to be patient. We have to follow the guidelines, and we have to be prepared. And that's both mental and physical health, putting good coping skills in, proper hydration, nutrition, getting things in place now so that if we are faced with another wave of this, we're prepared. The experts are looking for vaccines. They're looking for treatments. They're going to make things available so that if we do have another surge, we can tackle it. So worrying about the future is not going to help anything. We need to focus on the now and taking care of ourselves now.
Reopen the economy, Doc, yes or no? And will it make any difference in terms of the mass psychology out there as far as people actually going back to being the consuming creatures that they were before all this happened?
That's a good question. So reopen the economy, absolutely yes. That will help with everybody that is worried about finances, their jobs, their businesses. But we have to do it slowly. This is not something where you just open the floodgates or we're going to be right back where we were before we hit the surge. We have to do this in a slow, stepwise manner.
Well, we were seeing, and we talked about this last hour, we're seeing some states that have already done some reopening ahead of us, and they're not seeing the customers show up after they open up because people are still not responding. That's another aspect of this, but there's not really anything you can do to control that. As the governor keeps saying, it's not an on-off switch, and I think some folks don't understand that.
That's right. It's more like a volume switch. I mean, we can go up and we can go. We're going to have to modify things based on what we're seeing, and I think that's what people in other states are. They're not ready to rush back out there. Let's see what happens as we slowly do this before we make any more decisions.
Yeah, basically, we're seeing a lot of folks that you can sum it up as, yes, we need to open the economy. You go first.
No, let's just fall in the middle. Let's just watch, and then let's go. I think Mississippi's been lucky. We were one of the last ones to start getting the COVID virus. We've been able to watch states ahead of us. Let's keep doing that.
Exactly. Dr. Katherine Pannel, board member of the Mississippi State Medical Association. I enjoyed this. Come back soon, okay? I have a feeling you and I could do it.
In person next time, yes.
I vote. I'm in. I feel like we could do a whole hour if we had the time. Doc, we appreciate it. Take care of yourself. Go wash your hands.
I will. Thank you so much.
It's always good advice when you've been a